So we need to meet people where they're at.
Calgary's homeless population is eligible to get the COVID-19 vaccine, but some in the social sector say they're hearing from this population there's some hesitancy to get it.
Folks who have lived homelessness have experienced a great deal of trauma, and they have a mistrust of the healthcare system. And so they don't feel comfortable going to typical places where you and I would go to, such as your local pharmacy.
The homeless population is part of Phase 2C here in Alberta, which began on April 12th. In late April, vaccines became available in shelters. But even still, Joy Bowen-Eyre with the Alex says relationships are key in this rollout.
Yesterday, we heard a beautiful story of a gentleman who was 68 years old who had booked 5 different times to get a vaccine and had support to get there, had a driver to get there, but just as it was that vaccine hesitancy that we hear about. And so when our team showed up and we took the vaccine to where he was instantly more open to having a conversation about getting vaccination. And so we were able to relieve fears, treat him with respect and with dignity. And so our team was able to aid him and others as well, because there was that relationship that was already deeply embedded.
Chaz Smith works in outreach. He says there are some anti-restriction faith groups who are also fostering mistruths about the vaccine.
When you're setting up tables and you're not social distancing and you're, feeding the homeless and you're not wearing any PPE while you're preaching some of these conspiracy theories, that's a huge concern.
What a person experiencing homelessness might understand about the situation might be a little bit further behind, and that could, of course, contribute to some extra concern around getting the vaccine.
Megan Reed with Vibrant Communities Calgary thinks this rollout should have been at a higher priority, and this approach needs to become more dynamic.
There's a lot of evidence that's happening worldwide about bringing vaccines to the people. So pop-up vaccine clinics, going to where people congregate, making it easy for them, taking out barriers related to transit is pretty significant, and making it a really comfortable and culturally appropriate experience for a lot of people as well, we know will absolutely increase the uptake of vaccines in our city.
In Calgary, Taylor Broad, City News.